day notice for the town of Saugus. We'll give you a copy. We'll let you know what's included in it, and that is what the retirees and spouses in this room will get. You will also note, from time to time, we'll be reaching out to you, make sure if anybody has a P.O. box. You don't live at a P.O. box, do you? If you do, I'd like to meet you because I'm looking for a house, a cheap one. So P.O. boxes are great for mail, but when we need an address, and Jen might reach out to you and say, I need a legal address to get you approved on the federal plan, you are going to use the address you use on your income taxes. Because by law, to be on this plan, you have to have a legal residence within the United States of America. So don't get mad at me and say, Monica, because once you are accepted on the plan, after that point in time, we can change it back so mail can get to you. And we will keep you starred, flagged, and everything. But that tends to be the most complicated piece for people is P.O. Box versus addresses. We'll also be talking a little bit about enrollment and getting your Medicare information. The town has a good supply of that already, your red, white, and blue cards. But in this transition to Maya, some of you have missing Medicare information. It doesn't mean you don't have it. It just means we don't have a copy of your card, and we may need that. So those are the only pieces of information we're asking you for. Yes? We will. I'll do that as well. All right, so 3 pieces of information I've given you there for materials. Communication that you should be expecting will be that 21-day notice, and then in the June timeframe, please be expecting a letter of confirmation to the plan, a medical card, a welcome kit, and a prescription ID. Like I said, it's a lot of communication, but it really only comes in, you're going to get 3 separate mailings, all right? Count them 3. So keep an eye out for those. If you're moving, traveling, or whatever, please have someone watch your mail, as this is private information for you. Want to make sure you get it. And if there's any delay coming to July, as I said, the town will have your medical and your prescription drug numbers on hand. So if anybody needed an immediate fill at the pharmacy, we could make that happen so nobody is delayed through the transition. So that's a little bit about the mail order service and submitting. For those folks who may feel that they need a prior authorization or what we call a coverage determination form, I have those available up front. Certainly happy to provide those. If you're someone who takes generics, you know you're not in that situation, you've looked through the booklet quickly, no need to take it. We'll also provide them to Jen online so she can have those. All right, communication. Jen also will have a particular site dedicated to folks here. It's called a microsite. There's one that's for the town that deals for active employees and retirees. And there's one that's unique to Jen's level that if you got any piece of communication at any time and didn't know what it is, she can look it up or she can call me and let me know. All right? You're only asked, the action items that I've asked you for today are to take a peek inside the formulary booklet, work on prescriptions or that mail order, but what's the first date you can mail it away? July 1st, okay? Don't do it beforehand or else it will not be processed. And please call the number there if you need assistance prior to sending in the mail order form. I would hate for you to send it when you could have actually spoken to someone in advance of that. Communication, you should be expecting 3 pieces, a 21-day notice, and then the welcome packets and the ID cards separately. Based on our model today, thank you, we know what those look like. The only mail that you will get after you're enrolled in the plan is, remember we talked about earlier, in filling the drugs, that explanation of benefit, the monthly tally. Expect those, great resources, keep those on hand so you know where your calculations are within the plan. I think that's an excellent tool for you to have on hand. And then, once in a blue